Check, check, 1, 2.
Check, check, 1, 2.
Hey, hey.
Hey, hey.
Hey.
Hey, how's everyone?
All right, Grand Rising.
Hello, Kevana. How are you? Nice to meet
wonderful. Nice to meet you too.
Awesome.
Yes.
All yours, pal. Yes.
All mine? Me?
All yours. Yes, sir.
Thank you for the pleasure, sir. I appreciate that. All right. So Grand Rising family, greetings, everyone. So this is the latest episode of Grand Rising Collective Podcast with myself, Dixon, with my colleague, Kayode Bentley, and we have a special guest for you today, Miss Kevana Nixon. So before we get started, I want to introduce the family to just what we're about with Grand Rising Collective. We're a collective of myself and Kayode Bentley, and we're professionals, but more so we're community members. We're involved in helping the community to grow, become better. So we titled our podcast Grand Rising because it's a morning saying greeting to say like good morning, Grand Rising. And it's also a reminder to live your life better, to do better, to think better, to be better, and to always be grand in what you're doing and rise to the occasion. So it's a reminder for us to not only inform, not only to enlighten, but also to engage and empower our people. So we have guests on here. We talk about certain topics. I'm an educator by trade, also activist, and also entrepreneur. And in reference to my colleague, we do these things, incorporate our experiences in reference to help better you and better ourselves in the process. So without further ado, I'd like to introduce my colleague.
Thank you. Man, these things really kill me. Everything that Cal said pretty much sums it up with the Grand Rising Collective. So basically what I would like to introduce is myself in regards to what I bring to the table. So what I bring to the table as a quote unquote educator or mentor through my organization called 4T's, Teaching Teens to Think, in order to help their education, align their education with what they do naturally, so that way they can excel in higher education such as college, then use that knowledge and experience to get a job for the purpose of establishing a career and ultimately starting a business if they choose to. My demographic is particularly targeted to inner city youth. What I bring to the table at the Grand Rising Collective is being able to disseminate this information to our community at large, which includes parents, which includes young adults and adults in the community, and those leaders and organizations in the community and businesses as well. So that's why I'm honored and privileged to be a part of this Grand Rising Collective with my esteemed colleague, Kayode Dixon, in order to just share the wealth and not have these conversations in bubbles where it's just us talking about current events and things, how we've made it, but we can also share that information to the public at large to help build our community. So that's the long and short of it. And there you go. Anything else you want to know, just let me know and I'll be glad to answer. And my social media feeds will answer those questions for you as well. That's it. Thank you, Cal.
Oh, all right, sir. So so family, we have a special guest in the house. Special guest on the live stream today. Good friend of mine, a great colleague by way of fiber optics and distance, but we are working in unison together, right? And I'm so thrilled that she's on here because what she does is highly respectable work and is very undervalued in our community. And I don't want to speak too much, Kevana, but Miss Kevana Nixon is our guest for today. And I'm gonna give some time for you to just, do your thing, Kevana. Who are you? What do you do? Yes.
Okay. Well, first I want to say Grand Rising to you all. Thank you so much. I appreciate you guys for having me on here. Also, I just want to thank you for what you're sharing, especially the things that you're doing. The community needs it. And if you don't have platforms like this, they're not able always to get it. So thank you for, sacrificing your time, or not even sacrifice. It doesn't sound like a sacrifice. It sounds like this is something you want to do. So thank you. So yes, my name is Kevana Nixon. I'm a licensed marriage and family therapist. Full-time, I'm a program manager at a nonprofit mental health agency in Delaware. Part-time, I'm an entrepreneur. I have a private practice. I'm part-time where I see a couple of clients. Also, I support a lot of organizations, Black-owned organizations. I'm part of a collective that started a nonprofit called Black Men Heal, where we're offering Black men ways to heal through free 8 sessions of therapy. Also, there's nonprofits in the cities, but I live in Philadelphia, PA, work in Delaware.
Really?
Philly, stand up.
Yeah.
But my goal, again, same thing as you, is just to give back to the community, you know, the ones that haven't been impoverished and haven't had the chance to heal. Especially, I mainly work with children, adolescents, and adults. So that's my spiel.
Nice, nice, nice. And family, I am a part of Black Men Heal, but through her suggestion, by the way, I am a part of that. It's a dope organization. I'm still learning more about it. You know, it's new, right, Kevana? It's
only a great friend of mine, Tasneem Suleiman, who's also a therapist, had the idea. She's the founder. She's the creative mind behind it, and she just wanted some of her good friends to come along who were also therapists and said, "Hey, can you assist me with this idea?" But it's only for about a year, over a year now. Yeah, going on. It'll be going on 2. But 2018 is when we launched it. And it's just been growing from there.
Okay. All right. Cool. So I know my brother Kayode has some prompting questions. He always demand with the questions. You know, bear with this, family, because with the screen, I don't know if this works better for us or whatnot. Just trying a few things, but brother, I know Kayode, you got the questions, man. You know. Go at it, my brother.
Dang, man, you put me back. I got
you know, put you in the spot.
Man, I like to listen. I like to observe. I like to evaluate before I hit my questions. You're not giving me. Oh man. Okay.
Yeah, man.
All
right.
I don't know where to start. All right. So this part of the topics that Kevana, that I asked Kyle for, that I'm on them. I'm like, yo, what are the topics? What are we going to talk about?
I like it.
Research. Let me do my homework. But I think organically sometimes, you know, you don't necessarily need topics per se. But I'm astute to organization and I like structure. But as we know, we live in a world that's to a large extent not structured in certain areas, of course. So it allows for creativity. It allows for conversation in other areas that you can learn different things from that you wouldn't necessarily be able to had you followed a strict pattern. So I just wanted to make sure that I explain that. All right. So according to the topics, and we'll fly with it.
Right. Yeah.
Come on. I'm glad to be able to have this conversation with you since you're licensed, because I have this conversation with colleagues of mine as well. And I'm gonna go all over the place, so just be ready.
You're fine. You're good.
So, Kyle, just start here. I'm gonna start from the basics and then lean and then go, lean forward or whatever direction. One of the topics Kyle put down was getting your mind right. Now, Kyle, I'm not sure if that's a topic you created. I'm not sure if that's a topic you discussed with Kevana, but I would like to hear more about that. Like, who came up with that, or what is that about? Getting your mind right, and then I'll follow up with a question based on, the answer to that question. Is that in terms of young people? Is that in terms of adults? Is that in terms of our culture? Is it for Black people? Is it for white? What do you mean by getting your mind right? I guess is my question.
Well, that was prompted by me. So in reference of getting your mind right, making sure, I'm not gonna go into the hip hop thing right now, but it was a song about somebody getting their mind right. Okay. So that is a terminology, like, you better get your head together. You better get your mind right. So, I want to ask Kevana, like, what did that mean in her profession? And then, like, even how she even got into the profession, right? Like, how she started.
Yeah. So I'll start with how I got in the profession. So I haven't been in it that long, maybe 10 years, but I originally was doing other work. I was in the legal field. I was a paralegal. And something that always stuck with me that I learned from my mom and my family was do something that you love. If you're going to get paid to do it, it shouldn't feel like work. And so I was always on a quest for that. And it really came to me. I realized that this is something I already did with people, like, that I worked in the office with. They'd be like, Kevana, I need to talk to you on your lunch break. Give a chance. And I really had to sit back, like, what would I do for free? And this was it. It kind of fell together, and I went back to school, and I absolutely was made to do this, like made to do this. So so it's funny when you talk about getting your mind right, because I like the terminology because it does start with our mind, but the foundation is the healing part. The mind, is connected to the body, and so all those pieces connect, but also the healing then really dictates how your mind and body flow from that, if that makes sense. So in my mind, and getting your mind right, it can be taken a lot of different ways, because I will say, even when I started myself on this journey, and I come from my family's Black, so when I was talking like, hey, I want to ask questions, they were like, don't bring that home. I mean, it was very much like, we don't talk about things, we don't talk about our anxiety or depression, we don't talk about the things that have happened, the traumas. So it took a very long time for them to be on board with understanding what I was doing. And getting your mind right, like I said, I like to phrase it like, how can you heal, those things that have happened to you to get your mind and your body right? What does that look like for you? And a lot of times my discipline, or my background training is, I go to the root of it. Some therapists work from a standpoint of just talking about what's happening right now and focus on that. So if I have a client that comes in my office and they're going through a divorce, I have a client now going through a divorce, and if I just focus on the divorce, that's fine, we can do that. But I also know there's other things that are attached to it that connect why she picked the person, not her fault. And then what does it look like on the other end of her healing of this? What will that look like? And what is it connected to? Because a lot of times, it's funny, I hope to talk about this more, but in getting your mind right.
Yeah.
But usually it always connects to something that's rooted from maybe childhood or a trauma or something that was never resolved. And so it just continues to show up. People are like, I had a Black men heal client come in, and he was like, I had to look at myself like, hey, I keep getting in these relationships and I keep seeing the same theme over and over again. He was like, I don't think it's always them, I think it's me. And so when we say that phrase, get your mind right, that's the piece I think about. It's like, hey, what can I do for myself? How can I take care of myself so that I impact the relationships and the people around me in a different way? I hope I was all over the place.
That's good. I got some stuff I'm gonna hit you with, Kevana. I'm just gonna let you know. All right.
Absolutely.
All right.
I'm ready. I love it.
Yeah. Yeah, go in.
All right. So and wow. Okay. So just dive into this thing. How much time do we have, Kyle? How much time do we have?
Oh, we got time, man. We got enough time. We got time.
All right.
We got time.
All right. There's so many things I want to ask you because I understand that your guidance services for children and youth. You also your profession is in marriage, family therapy, and counseling. Cal and I think a bulk of our discussions deal in reference to obviously the community. Obviously, for me, my background, youth, family therapy, whatever. So I'm building up to something. I'm just letting you. I'm prepping you for what I'm about to ask you. All right. So I'm gonna get this out. Yes, Kyle, just cover your topics first. Let me collect all this information first.
Okay.
And then I'm gonna come. I gotta get you. Not get you in a negative way, but I'm
no, it's cool. It's cool.
The next topic.
So here's what I want to get into, right? So in reference of Kevana, what you do, especially working, like we work with the youth. I work with the youth. And I'm gonna go straight to it. A lot of our youth, and I've had this talk with some of my colleagues, Kayode is one of them, about how youth are going to marijuana for therapy. And how they're heavily relying on popping pills and marijuana, not even maybe legit marijuana. When I mean legit, being like it may be laced with stuff, right? And this is nothing new, but I'm seeing it in some of my past students and a few of my recent students where, they come to school, you can tell they've been smoking, or they were smoking last night, or and that's just real. Like as an urban educator, these are things that we deal with as educators, and a lot of times we just kind of sweep it under the rug. And I think I really think that's a huge disservice to our youth. But again, we're not licensed as yourself, nor are we other type of medical doctors. But how have you seen that in the past or present, and how have you been able to handle that?
Yeah, well, like you said, it's very prevalent. Like it's a norm. And so I want to say two things. One thing is that I do have a different idea or thought process around the use of marijuana, just because of the recent just like expansion of the use and really understanding. And also what's very big about my field is the narrative, meaning the words and the stories we tell around things, right? So, like I said, so in my full-time job, I'm program manager, and I've worked in the community too in Philly. Is that I worked with teenagers where they were referred because again they're maybe getting in trouble, smoking weed, not going to school. They're out in the community fighting, getting in trouble with their parents, and a lot of times them smoking marijuana was one of the main issues. What I had to help parents understand, it wasn't like my job's not come in here and help have them stop. I have to understand. My key thing I always use with everybody is I have to understand to change. So I can't come in and say, yo, Kahim, he needs to stop. I have to understand, why is he using this? And what I found with most of the teenagers, it's a way to dissociate. If you understand what these teens, especially in inner city, especially Philly, what they go through. I'll give you an example. I work in Delaware. Wilmington is the city where I work in, and Wilmington has like one of the highest gun violence like in the United States, which you wouldn't think is a very small city. But one of the kids, I was helping one of the therapists out, and I went and picked him up from school. And I picked him up from school because the principal called, like, hey, he's showing out. You got to come get him. He can't stay here. Fine, we'll work it out. I picked him up, took him home. And when I was driving him, I was like, yo, do you walk this way every day? He was like, yeah. When I'm looking, I'm like, yo, the way he walks home is not safe. So if nobody has a full picture about what they're actually going through, what does it look like when they go home? What support do they have? Who are they connected to? What traumas have they been through? I had another client where he saw his cousin get shot in his head in his backyard. So a lot of when they're using these substances and pills is to dissociate, so they don't have to think about that on a daily basis. The children and the teenagers I come across usually have already had what we call complex trauma. So it's not just one trauma where they saw a friend get shot. It's they saw their friend get shot. Their mom's on drugs when they're not there, or they've been abandoned by people in their life, or they've been sexually or physically abused by somebody in their life. So it's a way not to excuse it, not to dismiss it, but this is to dissociate from the pain that they have to deal with on a daily basis, because this trauma does change the body and the mind. So that's the key thing. Also, when I'm talking about it, I can't go in. I have to replace it with something that's going to assist them with dealing with those feelings and those thoughts. If I just come in and say they need to stop, what am I replacing it with? How are they to cope with those emotions and feelings that they have to deal with on a daily basis? So I hope that answered your question.
How old is the youngest youth who disassociates, that use weed? How old was this?
The youngest I've probably come across is like probably 12.
Yeah, that doesn't surprise me, because Kevana remembers when I was in Chicago, so we go back, like we were, myself and my other colleague Corey, we were talking about just a lot of youth we deal with on the south side and the west side of the city, and when we talk about the trauma in Philly, the trauma, Chicago is one of those other places where a lot of youth are going through a lot of trauma. The adults too. We're going to get into that, but definitely when we talk about youth, it does not skip them. Like, people think that youth aren't going through these things, and they are, and they don't necessarily have the devices nor the wherewithal to feel like they're even in control. Whereas an adult may at least have a feeling that they might be in some control, but a youth may not feel like they don't have any control.
Right.
Kevana, do you think the onus? I had this conversation. I think it was you, Kyle. Do you think the onus falls on the parents in regards to the child only knowing how to cope with their trauma through weed, or do you think the onus falls on other people more than the parents?
I think it's a collective. I think it can start with the parent. I think the parents, if they're there, and whoever's involved in their life, are important. But it could be auntie, it could be uncle, it could be a grandmom, it could be whoever their collective unit is in their home. So when I say my discipline is marriage and family therapy, I work from a discipline where it's the systems. It's not just the individual. So I look at every piece. Where do they live? Who lives in the house with them? Who are they connected to? what supports, what are strengths, what are, I'm saying, some risk factors. So looking at all those aspects, like, hey, yes, the parent, whoever they're connected to and have a strong attachment to, meaning they have a secure person in their life who they know they can go to meet their emotional, physical, and mental needs. That person is important, but it's also who else is in the community, because when they go to school, what are they looking at? What are they facing? Also, do they have their basic needs met? Does the parent have their basic needs met? If you got to worry about food, water, heat, all those things, those are going to be another part of the aspect of how do we support them. So yeah, parents are very important, but also looking at like who is a strong base. And then again, who are the people around them? Who are the people in their school? What organizations like yours can they be a part of where they feel connected to?
Very well, personal experience. I noticed that for me, because I'm my organization is in partnership with the Boys and Girls Club, and when I go to work, I show them. I give an example of a mentor, which means I dress professionally. I'm on how I speak to them. I listen to them, which is real key. I let them know that their feelings are valid. Things of that nature, and that's what helps them heal. Unfortunately, I'm one person that deals with them within a certain span of time. And then when they leave the club, or just say for the weekend, they're going back into an environment that reinforces negative behavior. One of the things that I like to do in our discussions, in our film discussions, is I like to talk about tangibles and solutions. So let's say, for an example, I'm a young person, male or female, and I live in a home where it's abusive, where I can't depend on my mother, right? Because she's going through some stuff. I don't know who my father is, right? My mother has a boyfriend, the scenario. I don't necessarily have an organization or someone that I can trust. I have a teacher, but the teacher has other students that they deal with. My question is, what advice would you give a child, a young person in that situation, as they deal with getting their mind right, and as we deal with them using weed to cope or disassociate from the environment? What advice could you give them? If I was a child, what advice could you give them to help them make it through?
Well, one thing I would really, again, try to find out, there's got to be, usually in our life, and it's hard, a lot of times it's hard to pinpoint when you're going through it, that there always is a positive reinforcement somewhere, right? Like I said, with that situation, it is harder because it'd be different if I'm just a therapist off the street, and I'm giving kind of insight about what to do, not so much advice. But if I'm working in the home, I'm working with the whole family. With that child, I would say, hey, who in your life is somebody you can go to? They have one person. What is something, what's an outlet? What is something you can connect to? That's the other thing I'm gonna find, because also people don't realize relationships are the most important things in our life. They help us feel connected. So if I don't feel connected, let's say my group of friends is getting high and smoking weed, and I know the only way I can connect to them is doing that, that's what I'm gonna do, right? So I have to find something that connects for them, that's important to them, So I would have to know, who are you as a person? What do you enjoy? What do you like? What makes you smile? I would really try to find those factors and find at least, again, one person who listens to them for 5 minutes. Like you, I would say, even though it may seem very small and what you're doing is not. Let's say I took that away and they didn't have anything. They didn't have you to just listen to them for 5 minutes. A lot of times the therapists that I work with, they'll feel like that. Like, I feel like I'm not doing enough. I'm like, but you are, because if you weren't there, what would they have? What would be the thing that would give them the space to talk about how they really feel? So that's what I would kind of, some insight I would give to a child who's kind of going through something like that.
Do you think, in your profession, with your experience, do you think it helps the child that there's someone there that actually listens to them and validates how they feel? Do you think that's
absolutely? Because that's really all they want. They want somebody who knows they care. So if I'm working with a family, I'm going in the home, and a lot of times the parent will be like, oh, well, I mean, it's a whole cultural thing, but they're like, oh yeah, it's the child. They're doing this, they're doing that. And the first thing that I talk to them about is that you're the most important part of this process. I can't do this without you, mom, dad, grandmom. Like, I'm only here for a short period of time, but I need you. And so I have to reframe in a way about what it looks like to assist their child. you know. But if they don't have that connection, if they don't have that person, then it's gonna be a little bit harder.
Gotcha.
Okay. Kevana, I want to tie it in and in reference of when we talked about the marijuana, the popping pills. How has medication changed in your experience? How has medication changed in reference of dealing with trauma, dealing with stress, in reference of the field of the therapy counseling field, like the negatives, the positives? With the, we talk about CBD now. CBD is heavy.
Yeah.
How has that affected the culture of like therapy and counseling?
I would say it hasn't impacted it totally, because I think everybody still has the same narrative, especially the psychiatrists or psychiatric nurse practitioners that I work with at my agency. A lot of them still stick to the traditional medication that they've been prescribing for years. A lot of them are not recommending like marijuana or CBD oil. I will say, because again, in the nonprofit I work with full time, it's mainly children and adolescents, but they're prescribed medication at a very young age, which I'm not 100% for, because usually they don't understand other factors that are happening. Because what ADHD can look like for a young Black male, because they're highly diagnosed with that, is that this really PTSD. So if I can't concentrate again because I've been getting physically abused, that's not ADHD, that's PTSD. You can prescribe certain medications to assist with maybe some of the anxiety and some of the symptoms around it, but to get to the root of it, there needs to be, therapy also with patients. But I would say a lot of again, psychiatrists, nurse practitioners are still sticking to the traditional medications that they've used for years to prescribe, for diagnoses such as ADHD, depression, anxiety, bipolar disorder, those things.
Is like I've not listened to a lot of people and now YouTube influencers and commentators. My question is I know post-traumatic stress disorder is something that has been diagnosed as something valid, because that's what those in the service come back with from being exposed to such traumatic, events. But with regard to ADHD and particularly inner city youth in the schools, is that really an I don't know the word.
Like legit? Like
legit? Because growing up, I'm dating myself. I'm up there. I'm in the, in the 90s, we never heard of ADHD. But my parents, if I was too energetic or whatever the case would be, she put the whip to my tail, my dad, and I'm the drug.
Yeah.
Right.
So my question is ADHD something made up or man-made to drug our inner city youth to keep them comatose? Or is it a valid, real thing?
So that's a great question. I think it's a deep question. If y'all ever listen to Umar Johnson, he definitely will give you background about it. He could be an extremist. There's some things Umar Johnson says, Dr. Umar Johnson says, and I'm like, yes. There's something I'm like, okay, all right, bruh. But you're going a little bit far. But there's definitely some validity to that. Meaning, I look at it as a systems thing. So if you think about, I'm going to date myself. So I was born in 1978. So when I was going to school, like you said, I don't remember ADHD. I don't remember that. I mean, it was prevalent, but I can remember in the school I went to, teachers didn't have 25 to 30 students, who they're all trying to assist at one time. So I think culturally in how the system has changed is that, one, because of the resources we didn't have in school, you have less teachers with support, and Kyle can speak to this because again, Kyle's in education, is that there's less resources for teachers, there's less support, there's more students. And so in order for me to fit this child into a box, now I need to label it with something, and I need to put a medication with it so you can sit and be a zombie, right? So that's my belief on it. Like it's partly made up to fit the culture and the system of what they want to do. I think also they don't understand our young Black children. So because they can't label it, they can't, even to this day, I go to school, I work with schools all the time, and they still struggle with understanding how to work with a child who's been traumatized. They still will do the certain behaviors where our therapists are going in the schools and saying, hey, Zamir has this and this and this. So in order to, don't just touch him on his shoulder, prompt him, call his name first. And they will do the total opposite. And then when he starts acting up and throwing the desk and tearing the whole classroom up. They're calling us like, you need to get here. He needs to be hospitalized. I'm like, well, did you do the steps we asked that we requested that would assist them? So, I'm sorry, I kind of veered off, but just giving a description of, again, I think it's a system problem. And I think there's some validity that it is made up because they don't know what it looks like. They didn't even realize for a long time that PTSD just wasn't for war veterans. It was for inner city youth who are, again, having to constantly see people hurt and shot in their community, losing people, losing parents, just all kinds of stuff. And to where it's like, oh, well, yeah, you know what? That's PTSD too for them. So
yeah. And speaking on that, Kevana, like we talked about this before, like Dr. Joy DeGruy, like post-traumatic slave syndrome, post-traumatic stress syndrome, PTSD as well, for family who don't know that acronym. These families are growing up in war zones, like, unfortunately, due to the socioeconomic position where they're at in the neighborhoods. And again, that goes from down south to west coast to up north, all across America. And it's interesting because with the ADHD, when me and Kayode talk about these things, it typically, when you think of the typical ADHD student, you think of our children, you think of Black and brown children. And that's a problem. That's an issue for me as an educator. And you're right. When I was working on the South Side of Chicago, when I was working for my 3rd and 4th graders, I had a classroom. My classroom got up to about 31 students.
And did you have any assistants in the classroom, or was it just you?
No, just me.
Right. Imagine that. 40 third graders by yourself. And again, that's 30 personalities, young children who are dealing with everything. And then you're the one person that's supposed to teach them and maybe not know all the, things that go on with them. So yeah, I'm sorry.
Indeed. No, that's real. I was stressed. I'm not gonna lie. I'm a young teacher. I'm coming in the gate. I was stressed, but I was young and I was in the fight. I knew what I was dealing with. And I didn't know all the dynamics, but I was like, look, they're in my hands. They families have trusted me, and I'm gonna make sure that I treat them with the utmost respect that I can, because these are like my younger brothers and sisters at the time of the age I was. So there was a few students that spazzed out in the class. I'm not gonna lie. They spazzed out throwing chairs, trying to rush at they classmates, and I had to like break that stuff up. And but we always had a talk. I always make sure we had a talk. And there's this one scenario, and I want to share this with you and the family, Kevana, because I hope I handled this right. But I had one student of mine. She sat, her desk was in front of mine, and I could tell something was wrong with her because she was kind of sleeping in class. And I'm like, what's going on? And she's like, well, mister, my mom and my mom's boyfriend were up arguing last night, and and I couldn't really get any sleep. And I said, how does that make you feel? She was like, I don't really like it. Like, they're most of the time they're cool, but just this time they were up really arguing, and I felt some kind of way about it. She felt scared. She felt, sad about it. And I said, have you talked to your mom about it? She said, no, I haven't. I said, well, look, and I shared with her. I said, look, my parents went through some troubling times in my household, and I did not at that moment share my feelings with them. It took me years to share that, but you should maybe talk to your mom and tell her how you feel, and express that to her. And I could tell they're kind of like, man, maybe I should, And the next day she came back and said, Miss Diggs, I talked to my mom and da-da-da-da. I was like, okay, how'd it go? She's like, yeah, we talked. So I could tell that, hopefully that was the good thing to do. But I was surprised at myself in the moment that I shared that, because I was like, wow, I'm her teacher, but I'm trying to connect with you.
You're a person.
Yeah, exactly.
You're a third grader.
Exactly. But it seemed like it worked. I don't, But that's what my training comes into. I mean, that's me, who I am, but that's also my training when you talk about like the schools. Who are these educators with our children?
Yeah.
Like, how are they relating to our children? Do they understand? Do they understand?
Yes, white teachers. Yeah.
It's funny you mention that, because just to piggyback off of what you said, Kyle, I had a situation with one of my youth that I deal with who couldn't go home. He, and I don't know if he's listening, but he had a situation with his parents where, I don't want to divulge too much, but his mother was on some other stuff. He's a young man who's burdened with the responsibility of having to be the head of the household, and he's not even 18 years old. So he has he has a younger brother, and the mother has a step, the mother has a boyfriend, so to speak. Anyway, long story short, the optional suggestion that I gave in sitting down and listening to him and allowing him to vent and allowing him to express himself was he didn't have any place else to go but home. But what they would do is they would lock the door on him. If he got in at a certain time, he would be homeless. He would be having to sit out in the street. So the advice I gave him was go home and just let your mom vent. Let her yell. Don't say anything until you can provide for yourself. That's your only shelter, man. Just calm down. Just go in there, rest, relax. So the point I'm trying to get to, Kevana, is my suggestion to him was to listen and just let them sleep it off. And tomorrow will be another day, and tomorrow will be there. And that's what he did. He when the club closed, he took his time in going home, but he made sure he got in before they locked the doors on him. He let his mom vent. He let the family, attack him. And he didn't say anything, and he let it just die down. And then the next day, it turned out that it was a new day. His mother is like a totally different personality, and it's been smooth ever since. So there, type of households and certain type of personalities, there's certain approaches to use, and that's the approach that I use with one of the teams that I deal with who has that burden.
Yeah. No, it becomes a sticky situation because again, they're coming to you with a heavy burden. They're like, hey, I don't know how to deal with this, and so you're limited on what you can do. And I think both of you handled it in the best way that you could and gave them good feedback. I just know that, like you said, with our youth and working with them, is that a lot of times the community or adults or the parents put the onus on them. And I'm like, the onus falls on us together. Again, like I said, when I'm working with parents, and let's say I've worked with a million moms or dads or whatever, and and me relating to them is just connecting to them. Like, I know what your intent is. I know what you want to do. I know why you're responding this way. So how do you think that impacts how your child sees you? How do you think that impacts your parenting? Not saying you're a bad parent, but saying you're really going through some stuff, mom, right now, right? So maybe you can't be the full mom you want to be. So how can I help you get there? It's not going to be perfect, but how can I support you? Because then exactly what happens for them is now going to impact their child or the rest of the family, whoever is there. So.
I have a question for you, Kevana. In dealing with parents, and I don't know, maybe the statistic has changed. How many has there been an increase of fathers in the home, or an increase of?
I'm sorry, there hasn't. That the crazy part is so for community-based services, Medicaid only pays for community-based services where my therapists go out into the home, support the family, support the child or the adolescent. Most of the time they're requesting a black male therapist because they're like, oh, the mom has already requested, hey, he needs a male mentor. She needs like a father figure. And so, no, it has not gone up. I can say that. And yeah.
Okay. Wow. How do, because when I talk about like things about like therapy and whatnot, like how do they seek out these services? Like, because I know for me, it was more so like, well, okay, I know this child may need help, or my students may need help, because I deal with youth and adults. I deal with like the teenagers, and I deal with adult learning too. So that's from 21 up to 65. Like, so I do that wide range. How can I be a conduit to like connect them to services, like proper services? Like,
no, that's a great question, because a lot of people don't know, and there's not enough information out there for people to be like, hey, yeah, go right here. So a lot of times to access the services or be connected to it is each state has like a behavioral health like section that they're oversees for children and adolescents. I would say find out what it is for your state, and that's the main source. You can give that number to the parent can call, and they can start the process of finding what supports they need. So like I worked in PA, I work in Delaware, is that each state has a department of behavioral health that supports youth and teenagers up until the age 18.
Okay.
That's the main thing. Then there's a lot of, I can't speak for New York, but I know in Delaware and in PA, there's a lot of local nonprofit organizations that I even work for in PA and Philly that support children and youth. But a lot of times, again, it comes through that State Department because most of the services, it's funny, most of the community-based services, which everybody needs, and I want to talk about that a little bit more, is that they're only paid through Medicaid. I'd say the middle class kind of really gets hurt by this because if you have private insurance won't pay for a community therapist to come to your home and support you.
Wow.
You would have to pay out of your pocket, or you'll have to pay use an outpatient therapist. But you might have circumstances in your home where there's more going on. You need more support out in the community in your home. But yeah, I would say first check your, I said, state departments that support, children and adolescents, and then also just identify some local nonprofits that work specifically with children and youth.
Right. Okay. Yeah. Because thank you for that. Yeah, because I know a lot of times with even myself, like, one, where do you start, and like, who do you trust? I mean, this is touchy feely around, especially in our community. Black and brown, African Americans, Latino. This is taboo for a long time.
Yeah.
It's just now, I feel like it's just now starting to like become less have a less negative stigma on it.
Absolutely. Yeah. Jay-Z went to therapy, Kid Cudi, these people are expressing, hey, this is what's going on. And they're like, oh, wait, it's all right. I need to go, which is great. Like, I'm glad that people are opening that door. Like you said, I think the other part that needs to be worked on, and like you said, talking about adults, is how do you find it? Because it is hard. I've actually lent help to my friends who are like, hey, Kevana, I can't tell you how many calls I get where like, hey, I need to find a therapist. And I'm like, okay, I'm one therapist. I'm gonna do my best to help you. But there's more ways of finding a therapist. But if you would have asked me 5 years ago, I'd have been like I'll get today. But our people are looking for more people that look like us to do therapy with. And so there's now more resources. There's Black Therapists Rock that have like a roster of Black therapists. There's Black Therapy for Girls, with the Black Men Heal. There's different agencies that are coming up. There's apps now, which I think is amazing, that help you find people of color to service you. And I'm like, that's amazing, because it really, really is hard to find good therapists and Black therapists. So.
Definitely. And that's my thing too, because like I have the Liberate app. My brother Al, shout out Al if you're watching. Calm app. What else? Like you said, the Black Men Heal. You know what I'm saying? Like, I mean, this is stuff that I'm just now really, really getting into. But like, it's so important. Like, it makes a huge difference. It makes a huge difference. It really does.
Yeah.
Yeah.
We focused a lot on young people,
Mm-hmm.
and we gave some tangibles in regards to what they can do. And I love your advice, Kevana, in regards to they can find that one person they can trust and went about it, which is great. But as for parents, now with the situation that's occurring today with the coronavirus and quarantining, children not being in schools, a lot of
52 million children are not in school right now. 52 million.
Wow.
Right.
Yeah.
So now the parents are left with the responsibility of having to teach their own children. And I'm seeing some feeds, some news feeds. I want to take my child to the teacher's house.
Don't bring him to my house. Don't bring him to my house. So
Kevana, what advice can you give to parents, which shouldn't even, it's their children, but what advice can you give to parents? Solutions can you give to parents, in this time, and how to?
Well, first, I think we should just, some of the parents who've been responding and the way they're responding, I get it. But just give themselves some grace, meaning, and a lot of people are like, oh, it's their responsibility, but it's not necessary. That's why we have a whole system of education, why they go to school. Because I'm your parent doesn't necessarily mean I'm supposed to give you this specific education. Doesn't mean I specifically know how to deal with you on a 7-hour basis where I'm teaching you and you have to learn. Like, that's a whole structured thing. Like, I think like there's always some highlights to some of the negative stuff that happens, especially with the coronavirus. But some people really can now see how important it is for, like, again, educators like Kyle to say, oh yeah, yo, we need to pour more money into them because they've got my child for 8 hours and I don't know how they deal with them. And the teacher doesn't read right, exactly. Right. So it's opening their eye, like, yo, we need to support them more, you know. So the help I would give parents is, one, give yourself some grace and give your, you know, patient. I can't say you be patient, but give yourself some patience. Like during this time, you know, this is another way to connect with your child in a different way. You know, maybe you're at work 8 hours, child's at school 8 hours. When you come home, you're tired, you don't want to be bothered. They probably need you, but learn to connect in a different way. You know, make it fun in the best way that you can. You know, do something that you guys don't usually do. Whatever I don't know, play Uno. I don't care what you do. Just find something that. I mean, Uno's a good game. You know,
it is a great game, right?
It is Uno. I use Uno all the time.
I don't want to mess with Uno. I don't want to mess with it.
Right. But, you know, just again, find ways to connect in a different way. Spend time. Give yourself some patience. You know, find ways to relate in a different way. I would say that. Yeah. Don't put the expectation on yourself to do what the teachers were doing. You know, and give yourself some breaks. You know, give yourself some breaks, whatever that looks like. If that means, hey, I need to step out, I need to call a friend, you know what I'm saying? Or I need to just step out the door, step out the back, really, in the balcony, whatever. And I need 10 minutes to myself, you know.
Very good. Very good.
Speaking on that, come out real quick, you know, and this shout out to my mom. Love you, Mom. I know you're not watching, but love you. So, you know, it was one time that just gave me a memory. I just thought about it. I remember one time my mother came home from work one day. And she was like, yo, just give me, like you said, just give me 10 minutes. Like, don't ask me, don't ask me what's this, don't that. Look, leave me alone for 10 minutes. She went to her room, closed the door for 10 minutes. After about 10, 15 minutes, she came out. She said, okay, now, what do you want to ask me?
Yeah.
I remember that just triggered that memory for me. Like, wow, you know what I'm saying? She needed that breathing room.
She needed that time to just, you know, same thing. As a therapist, I'm consistently talking to people and taking the energy and all the time, and people don't look at it as work, but I was like, no, that's energy work. That's mental work. Like constantly I'm taking on everything. So I literally, like an hour after work, I'm like, I can't talk to anybody. I just need that downtime to decompress. So that's the same thing for anybody. The kids need a break. They need a break from their parents probably yelling and telling them what to do. You know, like you said, download the Calm app. Everybody meditate. You know what I'm saying? Everybody do a mindfulness activity, you know, and meditation. And there's another practice, mindfulness. I like mindfulness better because it's not telling you your mind has to be quiet. It's just helping your mind come back into being focused. So you can do, I used to do a mindfulness activity with gum. Okay, so, you know, it's very simple. So pick the piece of gum, put it on your tongue. Don't chew it yet. Let it sit there. Focus on the gum. Focus on the taste of it. Focus what it feels like on your tongue, you know. Now move it to the left side of your mouth. Now crunch down on it. What does that feel like? What does it taste like? So the mindfulness just keeps you right there in the present. So they can do something like, they can do something simple like that. And if anybody's connected to Pinterest, Pinterest has a lot of ideas that are creative that can help them, parents or families with that.
Oh, nice.
Yeah.
Nice.
Yeah. The mindfulness doesn't have to be like, I'm sitting now. You can do something that's fun for them. Who doesn't like gum or Skittles, you know, and they can do that process and walk them through and just slow them down.
Okay. So I'm gonna ask one more question because I also, Kevana, I want to be able to discuss things that you're interested in because we've been bombarding you with a whole bunch of questions.
No, I love it. I love it. I love what I do. Yeah, I love what I do. Absolutely.
Amen. All right. So being realistic. What about the parent who is working, has a job, right? And like you said, in your job it's an energy drain as well. Because you have a lot of people ask you questions, right? And that's your job. So when you come home, right, you have another hat. You have to take off the work hat and put on the parent hat, mom or dad. So advice for parents who are just exhausted from work, drained. Are there any advice that you can give them when they come home and they're just so out of it, so drained, so angry, so frustrated? All those. Any advice can you give?
So same thing. Find time or space to take a break. So whether, let's say you have, like mine is my ride home. I work in Delaware, live in Philly. So I have an hour ride. So during my hour ride, I just don't talk to anybody. So I have that time to, you know what I'm saying? So for them, it might be walking from the train to their apartment. You know what I'm saying? Is it listen to their favorite music? put on your best song that gets you hyper excited. You know what I'm saying? Stop and have coffee. I don't know, just something that a small thing that you enjoy that can take 10 to 15 minutes, because that will rejuvenate you. It doesn't take. Some people think, oh, you need an hour, you need 2 hours.
Yeah.
No, you take 10 to 20 minutes just for yourself. It's something that you enjoy that refills you. It could be anybody, some people use gospel music. I use rap music. You know what I'm saying? I mean, whatever that is, again, your favorite cup of tea. It could be your favorite snack. You know what I'm saying? It could be walking. It could be anything. Just find that and use that to refill yourself. You have to recharge. Like I said, as a parent, I'm not a parent, but I can only imagine. I can only imagine what parents have to go through to raise another human being. I think is one of the hardest jobs people have to do.
I agree.
Yeah, but that's what I would tell them to do, because they need it. They need it just as much as anybody else does.
Thank you so much.
Indeed. So it's going into like you saying, Kevana, like that decompression. Like how is because I'm big into health. So how's exercise add into like mental, not just mental awareness, but like mental health and just physical health and just like overall well-being? Because you talked about it earlier, as far as like having those root causes, but also like what is the holistic way of like getting to the root of what that person is going through, or those people are going through. Like what's ways that exercise helps with that, like that process?
Right. So as you know, and I like I said, I'm not the best with exercising, so I'm not the expert on it. I know there's certain things I need to do. I do for myself that help me if I'm in my head a lot, So again, our body is directly connected to our mind. So if I have a lot of anxiety, my brain is constantly racing. But if I'm going for a walk for 30 to 40 minutes, that decompresses that anxiety. That helps me get out of my head. That helps me just be present with what I'm doing. But biologically, there's, endorphins that you get from exercising for a certain amount of time, which helps with depression. So if you're moving, something simple, like if I have a client who's depressed, and again, it's hard for them to get out of bed or do something, I'm like, well, just go take a shower. You taking a shower totally changes even the chemistry right there in your brain about what you're connected to, but exercising definitely, because your body is connected. I was just, I'm trying to think. I'll have clients that have somatic issues, meaning they have stomach issues or they have migraines. And a lot of times I'm like, oh, if your stomach's hurting, that means it's definitely connected to anxiety. You have a lot of anxiety. So how are you physically working on that? What are you eating? Because that also can irritate you. If you have migraines, again, you are severely stressed, so how are you decompressing from that stress? Again, meditation, yoga is great. Those things, definitely your body totally connects to your mind. So I hope I answered that question, but you have to find what works and fits for you, because it may not be working out. I know dancing around my apartment helps me, I'm not necessarily working out, but I'm relieving whatever's in my body. We carry, there's a book called The Body Keeps Score, and it's about trauma. So if you haven't, so let's say you experience trauma and you don't necessarily have the memory, because the brain protects yourself from it, is that your body will remember. Your body will have a sensation or reaction. So when I'm working with clients where they've exploded, and so I take them back, I'm like, wait, so what happened before you exploded? Where did you feel it in your body? And so some like, oh yeah, my hands got really hot. I'm like, okay, good. So that lets me know that's your signal that something's going on with you, that, you're feeling the same emotion, and then your body is triggered by it. So if people are paying attention to what happens to the body, they can connect it and then find some sort of relief through, exercise is great. It really is. I'm not the best at doing it, but simple things that you can do to relieve those things in your body, because it will connect to your mind. Hope I answered.
Very good. Very good. I'm guilty of that too. I think one of the biggest challenges that I have, because I feel like I have so much work to do. It's very difficult for me to motivate myself to get out and do a simple jog. And what also is so funny is when I do have that inspiration to do something athletic or healthy, it always turns out that it's like late at night. In the evening, it's like, now I got to concern myself about the environment and safe, because I want to be able to participate fully in the exercise without having to be worried about, all right, who's around, because you know what I mean. So I think it's just a matter of disciplining myself to be able to go to bed I'm still struggling with that, Cal. Go to bed at
time. Same here, me too.
You know what I mean? To wake up, early enough to get out there and get that push. Because once I discipline myself to do that 3 times, my body then wants it and craves it, and I'm that. But that's a very good point, Kevana. I think for me, it's just a matter of taking that first step and being consistent.
Oh yeah, absolutely. I can say, even as a therapist, I consistently struggle with that. Like, I'm going to get up, I'm going to meditate, I'm going to do something simple. And what helped me was that I had to really pay attention to how my body felt after I got done. Like you said, I have a lot on my plate. So full time, I'm a program manager. Saturday, I'm seeing clients all day. Then I'm also going back to school, and doing papers and reading. So I'm consistently on the go. And I notice in my body, like, I'm like, if I go to sleep and I sleep well, if I can't go to sleep and my mind's like this, I'm like, okay, if my knee's hurting, like you said, or my back's hurting, I'm like, and it may not, nothing, I've gone to the doctor, nothing's wrong. It's like, okay, so what am I carrying from all that I'm doing, And so, like I said, so I'll, like, if I go and walk and I'll pay attention to how my body feels, I'm like, I feel totally different. I don't feel how I felt when I wasn't doing those things, if that makes sense. So I just think it's people finding what works for them. It again, doesn't have to be this extensive workout or I have to join the gym, but you have to find, again, what connects and what works for you. Is it doing yard work? Is it just washing clothes? I don't know. You know what I'm saying? Is it playing with your kids, doing an activity with them? Is it dancing in your apartment? I don't know, but
yeah, that's real. That's what's up. Yeah, and I'm glad you meant that, because like some of my, I do yoga in the morning, so like I start to incorporate that, and it works. Like I like how I feel when I do it. If I can get in yoga and some running in the morning, that's like optimal. Like morning run, like early in the morning, is like great for me, and it kind of sets the tone and the mood for the day. And like Kayode was saying, like we've been talking about like getting enough sleep, because in the past I haven't really got enough quality sleep. And one thing I started to do is I was talking to a colleague of mine, and I started reading certain books, and they were saying like you shouldn't be eating at least 2 hours before you go to bed.
Right.
So, and not only that, they were saying that you shouldn't really be eating after about 11 o'clock, because your body particularly shuts down as far as digestion. So I tried that. I was like, okay, well, not just me, because I may go to bed at 2 or 3 o'clock in the morning. That's real for me. Sometimes like that. So that means I start eating by 1 o'clock. It's like, no, it's like I should stop by 11. I've been trying it for the past, I'll say about the past 5-6 months. It's worked wonders. Like my quality has definitely improved. And now I'm more rested when I get up. And I didn't know that. That one little thing kind of helped to tweak. And I was like, oh, wow, if I stop eating before 11, the latest. Typically, I try to stop eating before like 10 o'clock. And if I am hungry, I'll drink some juice or make a maybe smoothie or something. But yeah, it has improved my sleep. Well, can you speak on like how important sleep is? Like,
I was gonna say, sleep is, people don't realize how important sleep is. Like it is our time for our body to reset. Like literally, our body has to reset, and it is done through sleep. So some people who work on a couple of hours is that it affects your brain functioning, like how you are able to think and analyze and decision make. I used to work at a hospital where we would have it was a psychiatric unit, and we would have patients that would come in because they've had a psychotic break, or they've overdosed. And so I noticed with the patients who are bipolar and they were in a manic phase, and manic meaning they have all this energy. It's like a natural high. And so they're very grandiose. They're moving around a lot. They have all this, but they couldn't sleep. And so when they couldn't sleep, again, they would become psychotic. They'd have delusions. So sleep is very, very important for us. It really, like I said, it's a reset for our brain and our body, just to say, hey, I need a break from everything I've been doing. And if you don't get that, it really depletes the things that you need to do for the day. Okay.
Wow.
Now there's a couple of things I want to talk about, but I also want to make sure, Kevana, you good?
Yeah, I'm good. This is good.
Okay.
So your marriage and family therapy counseling. Now, there's this big thing going around in various ways. It's called, well, let me ask you, in regards to marriage, how do you see marriage as an institution being played out in this country? And like, how do you help that? How do you help? Because what I'm saying is that marriage is being frowned upon now. The divorce rate is going up. There's this thing now called MGTOW. I don't know if you heard of it.
Yeah, MGTOW. Yeah.
Oh boy. Oh,
help me out. Help me out.
Yeah.
Help me
You
out.
want to break it down?
God, God, you can break it down.
Break it down, Kyle. I've never heard of that.
All right, so MGTOW, right, is men going their own way. That's the acronym.
Yeah, never have it. Men
going their own way. So it's about men basically not. Again, I'm paraphrasing, family. So if I'm off, please forgive me. But it's basically saying that the power that you women yield or hold or use, they're not going to allow you to like manipulate them. So therefore, they're going to go their own way. They're going to do their own thing. And it's kind of like anti-women, which I'm like, I don't know how that works because I just don't know how that works. You know what I'm saying? Like,
I'm sorry. Go ahead.
Yeah, but it's this MGTOW, but yeah, men going their own way. So it's like saying that they're anti-women. They won't let women manipulate them, control them. And if they can't kind of, I guess, get in line, I guess, then they don't want to associate with them at all. So yeah.
That's interesting.
Yeah.
I've never heard of that. And I'm like, oh, that's I'm curious about it. Like, is that more millennials? Or is that like
no, this is our age group. This is
really?
yeah. Older and a slightly younger, yeah.
And the reason why I bring that up is because I've been raised in a Christian home. I have these conversations with friends of mine, lady friends in particular, and stuff like that. And what it derives from is, it's so much, it's so vast. So I'm not going to be able to talk, but I just want to touch on in regards to your counseling as you deal with marriages and stuff like that. Whereas now you're starting to see, the apprehension for men is coming from, they call it homogeny, I think it is, right? Where the perception, and I definitely want to get your take on it, Kevana. And I because I need a counterbalance to all the stuff I'm here to the perception is that women are only marrying men who are, number one, well off financially to a large extent as a way of a come up. So, it's like there's no the dream of happily ever after no longer exists. Because somewhere along in that marriage, and part of it, have you ever heard of the term called simp?
No.
Wow.
Y'all are schooling me today because I don't hear it. Look, I'm like, I don't hear any of this. I'm start asking my couples that come in. I'm like, have you heard of this?
Yes. Please do. That's why we're bringing it up, especially since your profession is marriage and family therapy and things of that nature. These might be some of the things that couples are, maybe confronted with and don't know how to address it. So what a simp is, Kyle, you want to explain what a simp is?
No, go ahead.
Acronyms. Right, y'all gonna have to text me this. I'm gonna have to write it down. Like what?
Absolutely, you can put it. And Kyle, you can put it in the chat if you want. What it is that you have. It's part of called red pill and blue pill, right? So, right. So the red pill, I believe, is a guy who has bought into catering to your woman, catering to the wife, taking her out to dinner, pulling the chair for, opening the door for us. And then the blue pill is not, man, that, trust me, it don't work because in certain women, I'm not saying all women, so, but with certain women, the challenge is taken away. And it's rooted in historical reference, whereas in high school, you had these young girls who was always attracted to the athlete or the roughneck of the guy, and the studious guy, the nerd guy who did his work, he was boring to them, right? So as they get older, you have a guy who's willing to cater to you, and then the woman sees him as a wimp. Oh, he's not challenging enough. I need some excitement in my life, and that's why they keep the good man there. But and this goes both ways. Now, men are guilty too. So I'm just. But my question to you is, from what I'm hearing, is like a lot of men in this MGTOW movement is like, nah, I'm not for marriage because if I dedicate myself to her, if I'm committed to her, if I do these things, she's going to be bored with me. She's going to leave me and go to somebody else because I'm boring and stuff like that. So my question to you in line with your job in dealing with marriage and family, have any of these, not in terms of MGTOW or simp come up, but has this in some other form reared its head, whereas couples want to they're second guessing their marriage or want to leave their marriage, or whatever the case would be, because of outside influences or something like that?
Yeah, well, no, I mean, these terms are wonderful and I need to know them. But this necessarily hasn't come up with my couples usually. So I want to dispel this myth as well. So with me being a marriage and family therapist, when people come in as if they're already married or they're about to get married, is my job is not to keep you together. That's the myth, is that I'm supposed to now do this magic intervention or treatment that's going to say we're staying together. I'm like, that's not my job. I'm helping you get the insight about what you want in this relationship, and is this person who you want to be in a relationship with? Do you want to be committed to this person? Because the first question I ask is, how committed are you to this process? You have to be committed to the process. If you're not committed to the process, you may not want to do it. So my job is not to keep you together. It's like, well, what do you want out of this relationship, and do you want it with this person? Right? So can we work through it? Because people are going to go through stuff. That's another myth. People think this happily ever after. The happily ever after is going through this stuff and coming on the other side of it, and knowing that you work through it and you still can care about this person, right? So also I want to say this too, is that the institution of marriage has meant different things depending on the era and the time, right? So when people think about this happily ever after, if I even think about my grandparents who got married in 1956, it may not have been necessarily that my grandmother was in love with my grandfather, but at that time as a woman, she probably couldn't own her own property, didn't really have a good job paying. So her way to maybe have a status or to even be able to do what she needed to do was to be married, So the institution of marriage itself, the culture, depending on the time, dictates what marriage is. I feel like if you look at our time now, is that women have been more, they don't necessarily have to be married now to have a baby. They don't have to be married now to buy a house. They don't have to be married to do these things. They've been able to do it, not to take away from it, but again, I think it's meant different things at different times, but people have still stuck to this idea that marriage is supposed to be this. And I'm like, no, marriage is an institution that was created by some people, but it necessarily means different things at different times. So the people that I see coming in, like I have a couple who are living together, they're more of a premarital counseling, premarital.
You're premarital.
So before they even get, and I love this, couples who before they get engaged are coming to counseling like, hey, how are we going to do this thing? What is it going to look like? Also have couples who are in the midst of it and they're like, look, if we don't work through this, we're not going to be together. Okay. I have couples who've gone through like infidelity and now they're coming in like, hey, we want to work through this. How do we work through this? So I haven't come across too many of the things you were talking about, but I'd be really, really interested to talk to those men about why they're feeling like that. Like what has happened in our society where they're like, no, I don't want to, like the verbiage that you use, Kyle, really stood out to me, like manipulated and kind of, used. And so I was like, wow, that's interesting that has been the discourse of how they look at relationships when, relationship is really being connected to somebody. It's not this piece, but what has happened in our culture where that probably has happened in relationship with women,
Yeah.
I don't know.
Yeah, a lot. Some of those guys. No, you did definitely. Some of those men, and again, I'm not in that movement, but it feels like some of those men feel like jaded. They feel like very jaded against like they feel like they kind of stuck to the idea of what a good man or a nice man or a nice person is supposed to be, and whomever they were with felt like they just dragged them through it, like kind of manipulated them, used their niceness as a weakness, or they weren't considered as attractive as other men. So they figure like, you should just like me because I'm good, or because I have morals, or because I'm maybe religious, I'm Christian. And like, nah, like I still have to be like attracted to you or something about you, that might not be what I'm attracted to. So it seems like some of these men, I think it's a white, to be real talk, I think it's a white male-driven movement, and gotten on board. I mean, personally, I'm gonna be real, I'm not feeling it because I'm all about community and family, and that looks different for different people, I understand, but I'm all about community and family. I don't believe in this man versus woman crap. I'm not on that. I've never been on that because I'm like, I come through a woman, I come through my mother and my father. Like, how does that work? There's no women? Get out of here. I don't know what you're talking about. That just sounds like a what do they call it? Cognitive dissonance. It's like,
it doesn't make sense.
Doesn't make sense to me. Now I get the pain and hurt because I've gotten, I've had my share, but you know, it's life. You know, I feel like, okay, it wasn't totally my bad. You know, it's just life. You know, it's like people are people. You know, and whether male, female, we all have gone through some things, and it's like, but I'm not gonna create a whole movie.
Yeah, I will say again, it speaks to the culture, you know, because I feel like because we have access to so much. Because I was talking to a friend of mine, I've talked to several friends of mine about children feeling like they're more entitled and they should have this and that. I'm like, well, they're exposed to, they have access to stuff that I never had access to. I could now go on my phone and find out everything I wanted to know on YouTube, on whatever, where now they can go. So that creates a sense of I'm supposed to, right? So again, I can imagine these men, it sounds like they're coming from a place that they've been hurt, but now they can create this thing I'm entitled to, I'm supposed to have this. So if you hurt me, now I'm going to create this thing where before it may have been, we come from a culture where it was like, you go through it as a part of life and you kind of deal with it and you go through it. Now they're like, no, because I can go on the internet and meet my 90-day fiance, you know, and do this, or I can, you know, I mean, the time presents with just different options that are easier, where it's like, I don't have to do this because I can get this quicker, easier, and I don't have to necessarily work for it. I don't have to go through that. I mean, I guess.
Kayvana, you brought up a very interesting point in regards to how marriages take on various or different definitions throughout generations or over the course of time. I've never heard that before. And like I said, I grew up in church. So in church, it was always the institution of marriage.
Okay, you're supposed to.
Right. And Kyle, you brought up like the MGTOW is not a black thing per se. It's more of another cultures type thing. Yeah. And what I'm noticing is I'm starting to see a lot, and this is why it's confusing me, because I'm seeing a lot of not only whites talk about it, but I'm starting to see it adopted or adapted by a lot of us in our culture based on what I'm seeing. So my question is, I always thought that marriage was always, you know, in the Bible, you know, scripture, do unto he who findeth a wife findeth a good thing. Love your wife. Wives, honor your husbands, with the understanding that there's a mutual respect, right? You love her, she loves you. You respect her, she respects. You make it so as a man that she can respect you and love you. You're not abusing her. You're not taking advantage of her. You're providing for her. And in return, and I think it's termed as everyone knows their roles. So it's really interesting to me how I've never heard that term before, as marriage is taking on different connotations throughout the generations. I find that very interesting. I just wanted to throw that out there.
No, I don't think a lot of people think about it like that. Like I said, I don't even think I thought about it like that till I got in the field, you know, and I've learned more and more, you know, as I've grown in it. But and even working with couples. But the thing that stood out that you just said is that people have this general idea that, you know, we have this understood rule that this is my role as a wife and this is my role as a husband. Like, oh, what's been bothering me is people putting memes or phrases on Facebook now, like, oh, you'll really know about your girlfriend now or your wife now if they can't cook. And you know what I'm saying, what else are you gonna like about them? And I'm like, so why do we have this belief again that if you're married to the person that the woman is supposed to cook for you? If you're not a human, should you be able to cook and provide for yourself to nourish your body? But I mean, that's a side note. But again, this belief that when you're married, you have the same respect. And what I've learned about couples is that the first question I ask them is, why do you want to get married? What does marriage mean to you? Because everybody has a different idea. If I come in and my view is that when we're together all the time and we have all the same friends. And my partner, my boyfriend might be like, my fiance might be like, well, yeah, no, not really. Like, you have your own friends, I have my own friends, but we come together for this. Is that if I have this idea of marriage and you do too, and then we come together and we get mad at each other because your idea is not mine, there's going to be a problem in the relationship. And that's my part to work through. It's like, well, why do you want to get married to this person? Why do you want to get married? What does marriage mean to you? What is it supposed to provide for you? What do you get out of it? You know, so that's the key thing. And then again, what did you learn about relationships? There's a piece that I go through with my couples where I do what we call like a genogram. So I do a 3-generational kind of like family map, and I pick up on the themes of what they saw in relationships. You know, like what did they? Okay, so let's say their father wasn't around, like mine wasn't. So what did I see? I saw my grandparents together. It was a very traditional role, you know, marriage. Grandmother did everything she could, clean, this and that. My grandfather provided, so it was very traditional. But for me, I would want it to be very opposite. And why is that? So I would have to look at those things for the family, like, what to expect. Some people, something as simple as, oh, well, at when we eat dinner, we eat together. Another person like, well, we sat in front of a TV and ate, so why can't we do that? That might be very disappointing or upsetting, but if you don't work through that or just understand it, then you're going to have these issues of, I have this idea and it's supposed to be like this. That necessarily may not be the case. What works for you in your relationship, and again, what do you want to get out of this marriage and from this person?
Dropping jewels.
Like, I got some jewels. I'm gonna write those down. Be like, have you ever?
Well, all right. Some of the things that I bring up, Kevana, and I would love to hear your perspective from the women's perspective on this. Is I had this conversation with you, Kyle, and I had it with Rodney too, where I'm noticing in the next generation X, generation, whatever generation is your name, because I don't even know the dynamics of that. But I'm noticing, and I always try and advocate for the women, the young girls growing up, because one of the things where we talk about cooking, right? A lot of women growing up, my mom cooked, right? So I know my grandparents. But a lot of these women are growing up in a household where they never, and that's the big piece, I consider a big piece, where they never had a example of a father in the home, right? They never had an example of what a relationship looks like you have with your grandparents. A lot of young ladies growing up in homes where there's a single mother.
Absolutely, yeah.
You know what I mean? So as a generation, what we're seeing now with Instagram, just self-insecurity. A lot of girls, in their early teenage years, 12, 13, 14, putting up pounds of makeup. They get 18, 20 years old. They're injecting themselves, enhancing body parts and stuff like that. Where does that come from? How does that even fit in the narrative of being able to settle down? It's the wall. There's so much stuff.
Yeah, there is. Yeah.
You know what I mean? So I'm just trying to tangibles and support sets for young women. And I guess this advice goes to young men as well. Any advice you give, Kevana, to how should, there's no course taught in school in regards to what you're teaching.
Yeah.
Right.
No, there's not. I wish there were. The funny thing is I had a conversation. I didn't grow up in the church, even though my family believed in God. I didn't grow up in the church. It wasn't until I moved to the south of Tennessee where it's like, oh, you're a heathen, you don't go to church. I was like, what?
Yeah.
So you out here all night, busting it up with everybody. I'm chilling, but I'm the heathen. It was just, but anyway, but I'm always been curious. And again, I'm a very analytical person, but I'm always curious about how the church functions. So I was talking to one of my therapists who's an advisor at her church over a group or something. And she was asking me about how she talks to a young woman who's 21 who got pregnant and wants to have an abortion. And she was like, I don't necessarily believe in it, but I want to support her. And I just want advice about how to support her. I was like, well, I think you're already supporting her. If she came to you, she feels comfortable talking to you, give her some resources that she can find out more information about her decision, but also know that you're there to support her through the process, whatever that looks like. She was like, yeah, well, I do have to go and tell my pastor and this and that. She won't be able to be on the dance committee. And I'm like, what? Wow. I'm like, we in 2020, right? So I was like, help me out with this. I said, so because she got pregnant before being married, you have to go tell your pastor. She was like, well, because I'm an advisor, she's sharing with me, I do have to share. I was like, oh, I said, but why does she have to kind of, and they even call a process I have to sat her down. And so she was like, I even have to remove her some a couple things. She's like, I'm going to have her do this. And I was like, wow, that's just interesting how the church has created this shame around certain things. But anyway, I digress in regards to talking about women and some of the things you brought up. Again, I think it just goes back to the era we're in, because that's totally foreign to me. My idols who I was looking at was Queen Latifah, Mary J. Blige, TLC, where, was very about power and movement. Now it's, even Lil' Kim was empowering to me, you know what I'm saying? And she was raunchy, but it wasn't like we got, the Nicki Minaj, I can't tell you how many of the different cash dolls, it's so much, it is a lot. But again, they just have a frame of reference. So it's hard for me to speak to them. But I don't know. That was a hard one because it's a totally different frame of reference for them about what they see in themselves and what they don't. Again, I have access again where I can create this whole narrative. I can change a filter. I can change what my body looks like, my face looks like through a whole filter on my camera, on my phone, about who I'm supposed to be. I'm usually at a loss of words. I'm usually at a loss of words with how to help them, because again, my frame of reference, even I'm trying to think when I do talk to young women, I really just try to pour into helping them find out what matters to them, what's important to them. Because like you said, they're coming from an era now where, again, my grandmother was a stay-at-home mom and took care of the kids and worked too, but she cooked every night, right? So then we're moving to an era where we have single moms where they're working all the time. They don't have time to come home and cook and then show their child about how to cook, right? So now it's easy access. I'm going to make what I can and you can get. So now we're moving to an era where we don't have the big mamas or the grandmoms to support that piece. So now they're relying on the tablets, the social media to entertain the child, right? And so that's where they're getting a lot of their information about who they're supposed to be. But again, there's still things that they can be connected to that have a positive impact on who they're supposed to be as women, you know. But yeah, I'm at a loss of words for the, really, because the one thing I know is that if y'all brought one of those young ladies on right now and I started to ask her about certain things, she would think about it. But that's where it would be left at, because she's comfortable already in her culture of going to Instagram every minute and getting her praise and her validation through those pictures, through those things.
Yeah.
You know. Yeah.
Thank you. Because these go ahead, Cal. I'm sorry. Go ahead, brother.
No. I was just thinking about like how the different images that women have, like when we were coming up, what Kevana's mentioned, like even with the Queen Bee, Lil Kim, but like you had Foxy, Lil Kim, Lauryn Hill, Queen Latifah, Lin Q, MC Light. You had who else, man? Who else?
Lauryn Hill.
Yeah, Lauryn Hill. Great. You know what I'm saying? Like you had
Heather B. You had, you had some other good people where it was like you had Aaliyah who could be tomboyish too. You know what I'm saying? Like it was this mix where you could be Missy Elliott. Like it was all these things that what being a woman looked a bit different. I don't want to take away from them because I feel like these women are finding strength in controlling the narrative about who they are. I will say that because again, there's been this double standard about if I'm sexy and I'm showing this, I'm a hoe, right? If I'm a man, I'm not doing this, I'm not a hoe. I'm not labeled anything, so I feel like their own, if I reframe it, is a therapist word in trying to find like positivity in a negative aspect of something, is that they're really using their power, their strength to say, hey, this is who I am, I'm owning it, and you should appreciate it, instead of tearing me down and saying I'm this and that. I mean, that's
and Kevana, just to interject real quick, I just thought of something. I remember I had one of my adult students, and I'm gonna name names, anything like that, but I had an adult student who was a dancer, and she didn't put it out there that she was a dancer, but she mentioned it in the class, kind of knew that she was. And the old me would have judged heavy, you know what I'm saying? But I could see her character, like outside of her being a dancer, I was like, oh man, this sister really, like, she really has a good heart. Like she really is trying to like get her education and really like better herself. So my talk with her was like, yo, like, be safe with what you're doing, but own it. Like if you're gonna do this, make sure you're your own business. You know what I'm saying? Like, make sure you control your narrative and control your image out there. You know what I'm saying? But that comes from like me talking to my elders and like not trying to judge people all the time. And like I said, it's really sincere too. And
I think that's a big part of it, is just not judging them. Like you said, I can't judge the women out here. I have to like, what's the positive? What are they doing this for? You know what I'm saying? There was always a woman or a man sometime in history where they were like, what are they doing? And it transforms something. So they're doing something to transform it. It looks different than what it would look like for us. So how do we find the positive in it and still encourage them?
Right. And it took me talking to her because normally I still don't agree with what she's doing, but again, it's not my life. But I was just like, it took me talking to her being my student for me to recognize like, oh man, this woman, she really like, she's just trying to go about it the way only way she knows how. Like,
yeah.
And it was like, wow. Like for me, I was like, wow. Like that was for me. I felt like, wow. I never thought I would feel that, but I was like, okay, yeah.
And I bring that up because, and the same thing for men too. Like, these young boys are growing up now. They're hitting their puberty, and I'm biased because I'm a dude, right? So when I talk to them, I try and share with them the essence of what it's like to be a man, a gentleman, and it's tricky nowadays because you have a lot of. I had a discussion. I think I shared this with you, Cal, the other day, where I had I do a program called TND, Toward No Drugs.
Yeah.
It's about drugs. It's about life, social skills, things of that nature. So I had young ladies and young men in the discussion, and I had a conversation with the young ladies, and I was like, I brought up the situation. Well, what if you had a man who took care of you, cherished you, provided for you and stuff like that? And interestingly enough, their response was, I don't need no man to take care of me. I don't need no man to provide for me. I could do it, myself. So then it puts it on like, well, what is the man's role? Because the man's role is to provide, quote unquote. That's part of our nature. But if we're willing to provide, we have women like, I don't need you. So it's kind of difficult to guide these young brothers and be like, okay, this is ideally what you want to strive for, but that type of women no longer, not all, but no longer exists. So I struggle with just trying to figure out a way to help these young men grow into a society where we have these different dynamics playing out. And then it ties into my, I want to bring that into like the family. What does that, how does that affect the family? Where you have these two dynamics going on, we have, different roles. No one knows what their role is now. And how do you mesh that into like a family unit, which is the source? Kyle, you bring this up, women are the earth, right? And
man.
No, it's such a complex topic because, like I said, I think it transitions from generationally and depending on what's going on at the time. And so if we look at the structure of family now, like you said, most of the time that I'm coming across, even for myself, like we lived with my grandparents, but my parents divorced when I was probably like 3 or 4, and my father was never in my life till I was older. So again, I come from kind of a mix where I did see people together, but again, it was just my mom who just took care of us. So we have to look at, so what narrative is that? Because I got the same narrative. My mom never said, you need to make sure you're independent, you don't depend on anybody. But I imagine that over the years, especially when the crack epidemic happened, is that it separated families. It created a dynamic where it was just women taking care of children, right? So what did that look like? The women had to depend on themselves. They didn't have time to say, oh, I can't do it. They're like, nope, I got to do what I got to do. I got to take care of my family. So then I'm not always, my message is not direct, like, oh, you need to do this. This is what the child sees, like, oh, my mom's doing it. This is what I need to do. I don't know what it looks like to depend on a man. I don't know what it looks like to have that support. So that's my narrative. So I think changing the narrative is seeing that we can do it. When you see the Jay-Z and Beyonce building a family, Barack and Michelle, even there's the web series Black Love, where it highlights Black couples, regular couples every day who are just going through it and just doing it, seeing more of those images and helping them like, hey, this is possible. And again, I would love to talk to young women like, oh, I can take care of myself. I was like, wait, where did you learn that from? You know what it looks like to depend on a man. What would it look like if you did? What would you want? Because I imagine none of us want to operate in this world by ourselves. That's why we have relationships. That's why we're connected to whoever, So I think it's a larger conversation because again, family looks different than it did 10, 20 years ago, and then again, what do we need? Like you said, there's a lot of women all the time. Everybody's, either they're freezing their eggs, they're having babies on their own, not to take away from it. Everybody needs to do what they need to do. They're partnering, some people are maybe not getting married, but staying in a relationship where it's like, you live here, I live here, and that's comfortable for us, relationships just look different. So it's like, what fits for them? So it may not be our narrative now, this is what needs to happen. It's like, well, what fits for you? It just family may look different.
Listen, we're going to have to do a part 2 to this, guys.
Yeah.
We're going to be on here forever.
Right.
Is there anything, Kevana, and this is your platform, I'm sorry. Is there anything that we haven't, that that you want to talk about, Kevana, that we haven't discussed, and then we'll wrap it up with like closing remarks and tangibles and action steps? Is there anything that you would like to interject that, because we hit you with all our questions.
They were great. No, I think you guys are providing a wonderful platform, and I want to say this, and maybe this is why I love Black Men Heal so much, is that you guys are needed and are so important. Like, our children need to see you, our teenagers need to see, our women need to see you in a different capacity, because yes, as women we are the earth, but you guys are the foundation of that earth. Like, you don't know how important you are when I see kids go in a classroom and they see a Black male teacher, or they see a Black man owning something, or just being around and like, hey, I'm here. It's amazing. It does a wonderful thing. So I thank you guys for doing what you're doing and being in the community. And I think this might be a part 2, but I would really like to talk about. Okay. I would really like to talk about healing and how family secrets have really caused some trauma that impacts our healing. I've just been doing some research with my own family and things, and how secrets, and a lot of times family secrets, like, oh, there was an extra child, or, this uncle physically and sexually molested this child, or, these secrets, or this is not your dad, and we find out when you're 20 that is your dad, or it's not your dad. How does that impact us as a people? And then how do we heal from those secrets? Why do we have those secrets? What is it about? But anyway, that's a
part 2.
That's a part 2. Yes, definitely a part 2. Oh, yes.
Yeah.
Oh, yes.
Okay, definitely. So, Kevana, Cal, schedule that. I'm able to be a part of that.
Okay, awesome.
So cool. So that's the part 2. Any tangibles and action steps that we can take from the discussion that we talked about today as it relates to, and it's a big one. What did you get from this discussion that we had? What tangibles can we take away from it and can give young people and parents?
And parents, people who are listening, audience members, because I know y'all might have questions or whatnot. So put them down below if you have some. But yeah, Kevana, please, like tangibles, like maybe some calls to action.
Call to action is that everybody just be invested and I like what you said earlier about listening, just listening. My key thing, and I think this is for everybody, is understand to change. Until I can judge or say we need to do this, I have to understand why this young girl, again, has to, dance in order to do what she needs to do. I can't be like, don't do it. Well, I can't tell these teenagers who, again, are traumatized severely not to use marijuana. What else am I replacing it with? So listening, also, connecting to resources that do support you, because I know a lot of times we're talking about, hey, whose responsibility is it? Like you said earlier, is it the parent, is the community? Right. It's everybody, but how do we support everybody? I can't tell this parent who may be struggling with depression, you need to step it up as a parent. How do I provide support for that parent who is depressed? Because they don't have support. So finding resources and connecting people to resources.
Wow.
Okay.
Wow. Who's next? You, Cal, or me?
Yeah, no, I'm trying to think while we have on. I'm trying to think like if I have any other questions.
Think about that. I only have one thing I want to ask. Why they killed it?
Yeah, man.
You're welcome.
Hey, man, we only associate with official people. I'm telling you. Like,
yeah. Kyle's awesome. I've known him for years. Yeah, so I'm humbled. I think I'm a vessel. I'm supposed to be here to share this information, and I hope that I really create something where people can heal and talk about these things because they're so important to talk about.
Absolutely.
And I want to highlight people like Kevana because she's actually doing the work in the community. People talk about they're doing the work. She's doing the work, and it's very highly valuable work that she's really doing. She's helping us unpack and become great. We talk about Grand Rising Collective. These types of methods and practices, and having people like her in her services. Man, are definitely heavily impacting our community, man. Like, they're definitely making ways for us to kind of get out of our own way. Like, and that's huge, man. I have big ups, like much respect.
Same here. It's an honor to meet you. I'm humbled and privileged to meet you.
Thank you.
You're very welcome. The takeaway there's a lot to take away, but Kyle, I gotta learn on being brief. We learned that from
Yeah. Be brief, brother. Be brief.
I'm trying, man. I'm trying. But I'm passionate about this. I love it so much. The way that I get is, and I kind of knew it, but in an abstract way, the commitment to the process, whatever that process can be, right? So, and we talk about this too, the exchange of energies, right? I didn't think about that until so it's very important you realize your question, Kevana, why are you getting married? what is your idea of marriage? I think that's an important conversation piece when you meet someone, because I put it in terms of my 5-year, 10-year plan. And that's what I try and instill in young brothers too. When you approach a young lady and you're looking to join, you're looking to join each other in life. Well, what is your plan, brother? What are you working towards? What are you putting actions up to? So that way she could see what you're about and decide whether she wants to be a part of that journey with you to help you along that journey and understanding your roles. Right. So with that is the commitment to that process. And that's included in that process. And I thank you for sharing that with me and me being able to take it out of the abstract and putting it into a more tangible term that I can share with young people in that way, asking questions in that process. So that's the takeaway I get on the action step that I give to not only young people, but our age as well. That's my mind on that.
Awesome. Well, thank you again. It definitely was. I'm privileged and humbled. Thank you for your platform, like really.
No, thank you. Thank you for sharing your time, and we're honored too. Thank you for sharing your time and your expertise with us. Like, this is definitely fire.
Cal, you got any tangibles and action steps from?
Man, listen to Kevana. That's what I was saying. Come on. Can they contact you? Can they email you?
Yeah, absolutely. So people, they can, if they want, follow me on Instagram. I actually every Saturday do kind of like a Heal on Purpose Saturday little tidbit about how people can heal. So they can follow me on Instagram on K-Love Theories. They can email me at Nixon, Nixon.Kavana@gmail. I'm not related. I don't know how we got the last name. But Nixon.Kavana@gmail.com and Kevana Nixon on Facebook. But yeah, they can follow me again. I try to give little tidbits, little here, like, hey, do this for yourself, check in on yourself, so we can start the healing process,
Indeed. And you said, come on, it's K-Love Theories?
Theories, yes. KLOVETHEORIES.
Okay, on Instagram, IG. Okay.
Hey.
All right.
Awesome.
All right.
For me, it's Balogun Logic on Twitter, BALOGUN LOGIC. That's on Twitter and Instagram. You already know the YouTube, the Grand Rising Collective. I'd be remiss if I didn't mention that where we have these discussions. Right. And then, my Kayode Bentley YouTube, and that feeds into all my other social medias. But those three in particular is where I'm at. And 4Ts.org is my youth development organization. So that's how you can reach me. Kyle?
Indeed. Yes, indeed, family. So thank you for sharing your time, your energy with us. You can reach me at Keasy773 on Twitter. That's KEASY 773. And then also on Instagram at DIX_KYLE, Dix_Kyle. So you can definitely reach me there. Give me a shout out, holla at me. All right. And thank you all, like, for us spending this time together on this day, with the Corona thing going on and just being in anxiety and just being in close quarters. I was glad that we were able to come together and Kevana was able to spend time with us to be able to share some of these methods and help break through this time of just, really coming together and really helping each other,
Yeah, absolutely.
Thank you so much.
All right.
I'm going to reach out to you, Kevana, on Facebook. So look out for that, and on LinkedIn.
Okay, perfect.
Yes, and we will, and family, before we bounce, we will be posting this probably on YouTube, a recording of this. All right. So if you missed it, right, please share it. We got some other guests coming up for sure. We know a whole bunch of people. So, and they as thorough as Kevana. So, be ready. Be ready.
Peace.
All right. Peace. All right.
All right.